The starting point for this discussion is the reality of scarcity. Human needs are effectively infinite. We always want to live longer, be healthier, and have less pain. But the resources to achieve that, money, time, skilled labor, are finite. This creates an economic reality called opportunity cost. Every dollar we spend on a heart transplant for a 70-year-old is a dollar we cannot spend on prenatal care for a mother or a vaccine for a child. We cannot do it all. Therefore, rationing is inevitable. We do not get to choose whether to ration. We only get to choose how to ration. Do we ration by price, by age, by lottery, by social worth? That is the ethical question. The first framework is libertarianism, most famously championed by Robert Nozick. For the libertarian, justice is not about everyone having the same amount of stuff. Justice is about liberty and property rights. A distribution is just if it arises from free choices and fair exchanges. If I work hard, buy insurance, and get great care, and you choose not to work or spend your money elsewhere, the resulting inequality is unfortunate, but it is not unjust. To the libertarian, healthcare is a commodity, like a car or a house. You have a negative right to be left alone, but you do not have a positive right to demand that I pay for your surgery. Nozick argued that taxing me to pay for your health care is a violation of my rights. It is essentially forced labor. The second framework is utilitarianism, stemming from Mill and Bentham. This is the logic of public health and economics. The goal is simply to maximize aggregate welfare, the greatest good for the greatest number. A utilitarian doesn't care about rights or property. They care about outcomes. If taking money from the rich and buying vaccines for the poor prevents more deaths and creates more happiness than letting the rich keep their money, we should do it. This framework loves data. It loves cost-effectiveness analysis. It asks, how can we buy the most life years for our dollar? The critique of utilitarianism is that it can be cold. If enslaving 1% of the population made the other 99% blissfully happy, a strict utilitarian calculator might accept it. The third framework is egalitarianism, most eloquently articulated by John Rawls in his theory of justice. Rawls asks us to perform a thought experiment. Imagine you are designing a society before you are born. You are behind a veil of ignorance. You don't know if you will be born rich or poor, healthy or sick, genius or disabled. What rules would you make? Rawls argues that because you might be the vulnerable one, you would design a system that protects the bottom. You would not gamble on a libertarian system where the poor die in the streets, because you might be the poor one. You would design a system with a robust safety net. Rawls proposed the difference principle. He said inequality is okay, but only if that inequality benefits the worst off. For example, paying doctors high salaries is okay if it attracts smart people to medicine, who then save the lives of the poor. But inequality that leaves the poor behind is unjust. Rawls viewed healthcare not as a commodity, but as a prerequisite for fair equality of opportunity. You cannot pull yourself up by your bootstraps if you are dead from a preventable infection. Therefore, a just society owes its citizens a basic package of health care to ensure they can participate in the society. The American tragedy and complexity is that we try to be all three at once. We have a libertarian market for the employed, private insurance. We have an egalitarian safety net for the poor and elderly, Medicaid, Medicare. And we have utilitarian mandates for emergencies. This incoherence is why our debates are so angry. We aren't just arguing about money, we are arguing about the fundamental definition of justice. When a libertarian talks to a utilitarian about vaccine mandates, they are speaking different languages. One is talking about rights, the other is talking about math. There is one more concept that disrupts all these theories, the rule of rescue. This is the human psychological imperative to save identified lives. If a child is trapped in a well, we will spend millions to dig them out. We don't ask if it's cost-effective, we just do it. But we will debate endlessly about spending that same $1 million on prenatal care that would statistically save 50 anonymous babies. We value the visible victim over the statistical victim. This impulse makes rational planning very difficult. It drives us to spend massive amounts on end-of-life care while neglecting prevention. Let's apply this to a modern problem: gene therapies that cost $2 million a dose. The Libertarian says, if the company invented it, they can charge what the market bears. If you can't afford it, charity might help. The Utilitarian says, does this drug save enough life years to justify $2 million? If not, we shouldn't buy it. We could save more lives buying malaria nets. The Egalitarian says, it is unjust that a rich child lives and a poor child dies just because of money. The state must negotiate the price or subsidize it for everyone. You can see how the theory dictates the policy. As policy analysts, your job is not necessarily to pick one theory and fight for it. Your job is to identify which theory is operating in a given proposal. When a politician cuts Medicaid to cut taxes, they are making a libertarian move. When they mandate vaccines, they are making a utilitarian move. You need to help decision makers understand the trade-offs. You need to make the implicit explicit. If we choose efficiency, who are we leaving behind? If we choose equity, what is the cost to the economy? To conclude, Lesson 1, justice is pluralistic. In a democracy, we will never agree on a single definition. We have to muddle through, finding compromises that satisfy the libertarian need for freedom, the utilitarian need for efficiency, and the egalitarian need for fairness. In the next lesson, we will see what happens when these abstract theories crash into a real-world life-or-death decision. We will travel back to Seattle in the 1960s to meet the God Committee, a group of citizens who had to decide who got the kidney machine and who died.